with these muscles of the face, Botox and Dysport and Xeomin, all of them are neuromodulators. And it's a very fancy term for botulism A toxin, a purified protein derived from the toxin that partially paralyzes these muscles. That's what its job is to do. Partially and softly paralyzing these muscles is what prevents fine lines and wrinkles from forming in the long run. So I always tell my patients, once the lines are there, it may take us a little while to fully eradicate them or soften them. And of course, there are other factors like skin condition, genetics, what skincare you're using, sun exposure, things like that. So Botox is helpful, and Dysport and Xeomin, for assisting you in softening these fine lines by reducing the muscle movement. And these are the muscles that we're targeting for the most part. So I will go through all of them. I'm going to start from the top down. If anyone has any questions about one of the ones I go over, or if I go too fast, or if there's something related you want to ask, please ask me. Just put it here, and I'm going to share this video again for people who are just joining, so you can always refer to it. So the first area, probably one of the more common ones, is the forehead. So this muscle up here is called the frontalis muscle. The forehead muscle is responsible for us, and I'm going to do the best I can because obviously I have Botox done, so I can't move a whole lot, but it's responsible for this, for raising up our eyebrows. A lot of the time there's this huge misconception of, well, I want a brow lift. Can you do my forehead? There's a very delicate balance between this because yes, we can treat your forehead, your frontalis muscle, and that will softly and gently prevent you from making such extreme motions and raising your eyebrows. So you actually won't be able to raise your eyebrow as much as you typically do. If you think about it logistically, if you're able to raise your eyebrows as much as you typically do, all that's going to do is create fine lines. There's no way to have both. The brow lifts are done by leaving the lateral portion of this muscle and neutralizing the medial portion so that only this works. So this is what gives that brow lift. Of course, a very subtle brow lift is nice. If you do it too extremely, if you leave too much active on the side of the forehead, you get that kind of like Spock brow, not so cute, kind of like that, and it's weird. It's part of why the reason is that I do touch-ups. So I tell all my Botox patients, I'm going to text you in 2 weeks. I'm going to ask you how it looks. If anything looks funny, I will touch it up. That's part of it. If you have like a weirdo Spock brow or something like that, and by the way, men are way more prone to this because their muscles are so strong, I can lower that. I would much rather have to lower that than you have the opposite effect, which is when you go somewhere that does like Groupon Botox, or people are inexperienced and they do your forehead and they go too low on your frontalis muscle. And what happens is you have no ability to raise your eyebrows up at all, rather than the little bit like what I have. And then your eyebrows actually drop. If you go too low, way too low, it looks like that. I'm not even joking. And there's not much of anything that people can do to fix that. You just have to wait out the 3 to 4 month duration of Botox before that goes away. So I aim very high on the forehead. I try to go pretty low with the amount of units. I would rather touch you up and have to add more than the alternative, because you can't take units out. So that's the frontalis forehead muscle, very common, and this is the result in a good treatment. A little bit of movement is good, not a ton of movement, and softening those fine lines. If you have fine lines at rest, if they're deep, those are not going to go away from your first Botox treatment. I don't care what anyone tells you. It's a combination of Botox and filler and maintenance before those go away. That's why when people say, well, what age am I supposed to start Botox? There's no right answer. There's a lot of factors involved. Botox done before the fine lines form is called preventative Botox, whereas when you have the lines at rest, it's more of like a therapeutic or curative modality for those fine lines. So that's the forehead. Second most common probably for me is this sucker. So this complex, and I say complex because I explain this a lot during the day. That sucker right there, you see how there's like almost 3 things you're seeing that are resting above the frontalis forehead muscle? The reason is because your angry complex, your glabella, or the 11s, is comprised of 3 different muscles. You have the procerus muscle right in the middle. It kind of looks like a fan. And then you have one corrugator here and one corrugator here. That's what's responsible for scrunching this into an angry 11. So when I do that area with Botox on my patients, they usually leave me with what looks like a V shape of tiny bee stings, which go down in 15 minutes after your treatment on their own. The V shape is because I'm hitting all of those muscle groups. Ashley wrote, how do I pretty? Ashley, you already pretty. Anyway, so how many units we do in all these areas is dependent on, are we preventing? Are we treating? Is your muscle very large? Is your muscle really small? Some people come in and when they do this angry thing, it's like a little speck. It's like this big. You're not going to get as many units as someone who goes like this and it's like, it's a huge thing. You need more units. So everything with Botox is customizable, which is why when I post like how many unit graphs, there's a range for every single area. It really depends on you. So another reason why I don't price per area, I price per unit, because someone may come to see me and they need 12 units there. And then someone else may come to see me and they need 20 units there. And then sometimes men come to see me and their muscles are super strong and they need 24 or 30 units there. So pricing by area, someone's getting gypped. Not everyone doesn't need the same amount of units. So I don't think it's fair. I price per unit, and those graphs are very good at like estimating a range if you're looking for a budget. But the only real way to assess how much you're gonna need is face to face. That's the only way. It's kind of like my boyfriend's tattoo shop. I've heard people come in and say, how much is a tattoo? And one person at the shop always says, how long is a string? It's true. Like there's too many factors. So someone wrote, how much is a unit? We charge, there's many different things you can use. Botox and Dysport are the two main ones that we have. Botox is $12 a unit and Dysport is $4 a unit. The thing is, you need more units of Dysport than Botox. So I don't want to get too confusing, but long story short, for example, if you need 20 units here for Botox, you need 50 of Dysport. So there's not much of a price margin. Those are the typical prices, like anywhere that's pretty average. The only time you're going to experience like, oh my God, $7.99 a unit of Botox. Something's wrong with that because that's pretty much the cost of Botox. So it's either that it's not legit. There was a place busted in Florida where I'm from where they were like buying like illegitimate Botox. It could be someone is just really inexperienced and they're trying to get training. It could be that the place has no traffic and their own Groupon. I mean, $12 is pretty reasonable per unit, honestly. A lot of places charge more than that. So that's these two together. Now, something I want to talk about before moving on is these two muscles are synergistic. They work together. If you treat, for example, if you treat the angry one and you don't treat the forehead becomes very obvious to you because you can't do this. So now you find yourself like doing this a lot to compensate. So a lot of times patients will come to me and say, my forehead didn't bother me before, but now I'm starting to notice it more. It's really good if you're going to treat two things together. It's always best to treat those two. And I tell people a lot. Alternatively, if you treat the forehead and you don't treat this angry line, it looks so weird. Oh my God, the amount of people, and I always counsel people on this beforehand, the amount of people that are just very against treating the angry line, don't know why. They usually, when I message them for their follow-up in 2 weeks, they always say, it looks really weird. I wish I did it. I totally notice it from the side. It looks really bulky. It looks like an avatar. I don't know how else to explain that. It kind of looks like a Klingon. Like when you don't treat this complex and you treat the forehead and the forehead is super smooth, you see where there's like a line right there? This becomes bulky. You can see it. It's weird. So long story short, it's best to treat those two together. If you're going to treat one, treat this one. But the forehead without the angry line is really weird. And I tell everyone that. See, Michaela said she loves when I put this filter. I am doing this because I got a lot of positive feedback last time I went through this with Botox. So I'm going to post it on my Instagram so it could be referred to later. So that's the forehead and the angry line. And of course, you could always watch this back. Now, when I do a brow lift, usually I'll do a little bit of Botox right here. You can see that tiny muscle under the brow. And what that is a continuation of your orbicularis oculi. This round muscle around your eye, and this eye too, it's like a big round muscle around your eye. Orbicularis oculi is just a circular muscle around your eye. And what it's responsible for is when you smile. Whoa, look at my crow's feet. There's a good one. When you smile, this crinkling is what's causing the crow's feet. So what we do is we do a little bit of Botox here, and usually it's about 3 pokes here, and you'll see 3 little bee stings when you leave. And that causes this muscle to kind of go like that when you're smiling. So you don't get as much scrunch. And that's what stops the crow's feet from forming. It stops the fine lines from forming. It relaxes that muscle. Alternatively, if you inject it high enough and right here under the brow or into the brow where I do it, you get a little bit of a brow lift because it opens up this way. So you're not going to get like the fox eye thread result from that. It's not going to happen. I don't even like how that looks if we're being honest, but you're going to get an opening. I do that like every 2 months on myself because I feel like I'm super hooded and it bothers me. So that's the crow's feet. Sometimes I'll treat patients, and this is kind of rare, but when you smile sometimes you could see that there's like a little roll. It's a jelly roll right there. I don't recommend this to baby injectors. I'm gonna do a live session sometime whenever I get like 10 minutes again for baby injectors. But this little jelly roll, you can put like 1 unit Botox in that sometimes, and you can soften that up. So that's kind of like a less common area around the eyes that you could treat with Botox. So one important thing, and I talked to someone about this the other day, and I don't think they believed me, but that's fine. If you inject the crow's feet too low, so a lot of times people will say, oh my God, when I smile, I have lines like on my cheek. They go really low. There's 2 reasons for this. One reason is if you're lacking cheek volume, if you've lost the fat pads in your cheek and they're kind of like flattening out, you have empty space that once contained fat. So now that empty space looks like lines coming down the cheek. So a lot of the times when people come to me with that, it's because they need their cheek volume replenished. We need to be doing filler in that area. And that will help the appearance of that. But I mean, the orbicularis oculi goes all the way down here. What's dangerous is if you do too much Botox in that area or you go too low, you're going to drop your smile. Look what connects this muscle and this muscle. Look what it connects to, your mouth. So if you go too low here and you paralyze that, when you smile, it's going to look like this. Like that. You can't lift the corner because this muscle responsible for lifting the corner, if you hit that, it's done for. So guess what happens if someone does that and you hit the corner and you can't smile? No smiling for 3 months, okay? You cannot fix that. Once the muscle's paralyzed, it's paralyzed. It's not like filler that can be dissolved. So you have to make sure you're going to someone who knows what they're doing. I say this all the time. My job is to inject you. If I say that you shouldn't do that, we shouldn't inject it, or you don't need that many units, how does that help me as an injector? I mean, I am telling you that because I have your best interest at heart. It's not about money or dollar signs. If I say that that's not a good idea to do, it's probably because you shouldn't do it. I like to inject. I want to. Keep that in mind. So truly, you don't want to go overboard in this area because, if you drop that smile, it's not fun, especially around the holidays. And I've seen it and I've had it and it's demoralizing. So I try to be very cautious and make sure you're actually in the orbicularis oculi. So moving on, a lot of times, and this is something I see all the time, when people frown, they also bring up their nose. Like it's kind of scrunches up, like they frown and they do both of those things together. This muscle right here is called the nasalis. It wraps around the nose. So sometimes people will have little fine lines here when they scrunch, and we call them bunny lines. And it's also responsible for this horizontal line up here. Treating this complex alone is not going to help the line that forms here. You got to treat both, because if you don't have this movement, you're going to scrunch to make up for it. The nasalis muscle, you don't usually use a lot of units here. You can see it on the charts that I post with the units. But yeah, injecting some neuromodulator there, some Botox or some Dysport, will stop you from scrunching. And that will also soften this guy here. So far, for those who are joining now, we've done the forehead, we've done the angry line, we've done the brow lift, we've done the orbicularis oculi, the crow's feet. We talked about the jelly roll. We talked about the nasalis, the nose muscle that causes bunny lines. I am going to share this video when I'm done, so you could always refer to it. But I think this filter is like the coolest thing I've ever seen, so I wanted to do like an educational video. So moving on, let's do Gummy Smile. So if you look here, corner of the nose, you have a muscle that's responsible for lifting up the lip, okay? Gummy Smile, I just ate, so I'm just like making sure there's something in my teeth, but Gummy Smile is when people smile and you can see the gums above the lip. And that's because that muscle responsible for lifting the lip when you smile is overactive. It's pulling up too much. So we know now that Botox and Dysport, the neuromodulators, are partial paralyzers of these muscles. So putting a little bit of Botox or Dysport here in the corners of the nose, sometimes up here, but I like to go here, it will kind of bring that movement down a little bit so it's not so hyperactive. So you're not like pulling it up so high. So when Gummy Smile patients get that and they smile, it doesn't show the gums anymore. That one, you know, some people need more than others, but it's still usually a pretty light dose, or you're going to drop the smile completely, and that looks very funny. It looks weird. I've had people who got the Gummy Smile feel very restricted when they smile. It feels like they can't smile as much as they normally do. But remember, that's the point. We're reducing your smiling. It doesn't look weird. It usually just feels a little odd. You kind of have to get used to it. So that's that guy. I know I say a lot. Don't come for me. The one right under it, this circle, it kind of looks like this circle around your eye. They're both orbicularis, which is like a circular muscle, but this one's orbicularis oris. Hi, Jessica. I worked with Jessica Packwood when I lived in Florida, and I know I'm having a squirrel moment, guys. It's fine. But I worked with her at New Radiance. She's in New Radiance Palm Beach, and she's incredible. She's definitely injected me many times, and I love her. She's got the cutest kids, too. But this round muscle, orbicularis oris, it's responsible for many functions, but mostly the pursing of the lips, right? A lot of times people will come to me and ask for a lip flip. And the idea of that treatment is when you apply those neuromodulators up here around the mouth, you are releasing the muscle that's responsible for this, right? So theoretically, you should get a little flip up. Now, I posted something pretty recently that was like lip flip versus lip filler. You're not going to get a lip filler result from a lip flip with Botox. It's not going to happen. It's not going to happen. So you're not getting volume, you're getting a relaxation of this muscle. Also bear in mind that Botox typically lasts 3 to 4 months on average. Some people a little more, some people a little less. So around the mouth, it's so dynamic. We're talking, we're chewing, we're eating constantly. I'm eating constantly. So it lasts maybe like 6 to 8 weeks before you have to do it again. We don't do a huge dose here because too much Botox in this muscle, it's very difficult to talk and to enunciate. So P, B, M, words that need those letters sound weird if you do too much. I've had people say that they feel like they're drooling when too much is done there. It's very weird. So I do very light doses there if I feel that someone would benefit from it. How would you benefit from it? You can totally tell when people are like putting a lot of downward pressure on their mouth, they clench their mouth shut a lot. Or when they smile, if they're not necessarily gummy, but kind of like show a little bit of gum, usually that helps people. Or if it like the top lip tucks under like this when they smile, it's like tucks under. A lot of people will lose their top lip. Lip flip is great for that. But again, will not add volume and does not last very long. The best combination or the best treatment is the combination of both the lip filler and the lip flip together, which I could do the same time as your at the same time. So that's the orbicularis oris. It's also helpful for if you've ever seen smokers or older people who have like the, you know, the vertical lip lines. There's a lot of reasons for that. I mean, anatomically, as we age, our mouths age by caving inward. You lose the lip tissue in your lips, so the definition gets lost, and that's what causes the little fine lines. Of course, using bottles for your whole life, smoking cigarettes, things like that are going to exacerbate them because you're doing this constantly, and it's just going to cause those lines to etch, just like the angry line or the forehead. So doing Botox around this, yes, it feels kind of weird, but it aids in pulling those lines apart and separating them, so you can't do it as often or as intensely. So that's an option for patients as well. I have an aversion to doing the top and the bottom because I feel like if you don't have both of them or one of them, you can't even drink from a straw. It's annoying. Some people like it. I'm not a huge fan, but I do love a lip flip. So there's that one. If we kind of move to the side, and oh good, I didn't know if it would follow me, but shout out to Nurse Megan for my jawline, and also Elena at Glamour Aesthetics in Boca. I love my profile now. I used to hate it, but anyway, there's a muscle right here, and there's several muscles above it, and it's the masseter. Okay, and this is what's responsible for you clenching and grinding your teeth. So right here, I can feel mine because mine is so intense. I need to do it, but there's a muscle right here that's responsible for your clenching and grinding. So you're hearing a lot of people talking about masseter Botox, masseter neuromodulators. The idea is if these modalities, if they're softly paralyzing these muscles temporarily, and you softly paralyze this, it helps. It's therapeutic for grinding and clenching, and it's really, really a relief. I mean, I have clenching and grinding. I wake up sometimes and my mouth is like clenched shut. The Botox makes it so that you're not able to chew or eat, but you can't hold it, you can't clench. It's really helpful. And because the masseter, for me as an example, mine is so strong, you can see it outside of my face when I clench. So like, look, see that? When they're that strong and you do Botox in those areas, Botox is going to atrophy these muscles, all of them. If you continuously do Botox, the muscles get weaker and weaker from lack of use. If you atrophy this, you're going to get that slimming effect in the jawline. And I've posted a before and after of that before, but it's important to remember that not everyone gets slimming, okay? Only if your masseter muscle is hypertrophic, if it's very strong, like mine, you see it outside of your face when you clench, then you're going to see slimming because it's contributing to the fullness of the lower face, and that's not for everyone. It is something I can tell you at your appointment by feeling it and by looking at it, but I always tell people, do the masseter Botox for therapeutic reasons first, because it's a lot of units. Usually you need like between 50 and 60 total at least to soften that muscle up because it's so strong, and you have two of them, so you have to think about it that way. Do it for therapeutic reasons, not purely for slimming. There are other things we can do for slimming filler-wise that last a lot longer, that are immediate, that are more appreciable. So again, why consults are so important. Someone wrote, can a neuromodulator quote unquote fix or relax M-shaped lips? So great question. M-shaped lips are probably the most difficult lip type that we see. It's the ones where kind of they go like this and it's like empty space here, very thin top lip. It aids in relaxing that top lip when you're smiling. So if you curl your lip under itself when you smile, trying to do it, it stops that from happening. So it's mostly, and Botox and Dysport and all these things are for the most part dynamic. When you're moving, this is what they're helping with. It's not really helping much at rest. Sometimes you get some help at rest, like for the brow lift, for example. But like the crow's feet, that's movement. The angry line, that's movement. The forehead, that's movement. There's some others we're going to go over, but M-shaped lips, the best combination is going to be filler and Botox together personally. And sometimes not even Botox, sometimes just filler. It really does depend on the patient's anatomy, the goals, things like that. But M-shaped lips are very easy to make ducky, so you have to make sure that you're seeing someone who's experienced with those. They're very difficult. Moving on, well actually while we're still on the masseter, we were talking about complications with the orbicularis oculi and how going too far down or overdoing it will drop the smile, because we saw the insertion points and how it connects to the mouth. If you look at the masseter here, there it is. It's a little far back on this graph from me. Mine's like all right here. If you go too far forward with the masseter, right, or you use too many, or you use something that spreads, Dysport spreads as a neuromodulator. If you go too far forward, you're going to hit the insertion of the muscles responsible for you pulling back your smile, right? So a lot of times when you see masseters that aren't done right, you see people who smile like this. It's weird. I had it. It's really weird. It goes up and down, almost like it looks like it hurts. Can't go back. It's because someone hit this muscle responsible for pulling the mouth back. This, normal, but like, hell no. That's really weird. There's nothing you can do to fix it. You have to wait 3 months. It is the most excruciating 3 months of your life. It's weird. It's uncomfortable. People around you will notice, which is why $7.99 Botox from Groupon is not a good idea. which is why you need to go to someone who knows their anatomy, someone who doesn't rush their appointments. If someone is doing their appointment in like 10 minutes, it's scary. But you guys, when you come to see your injector, it's an interview for both of us. It's an interview for you. You need to make sure you're comfortable with this injector. You need to make sure they seem like they know what they're doing. They're experienced. You feel like you trust them. It's also an interview for us. I'll talk about that another time, but long story short, I need to feel like I have your trust. I do a lot of education before my treatments. I would be sitting here lying to everyone if I said that I thought I could please everyone. We're artists in our craft, our ideals, our everything we like. It's all subjective. All of this is subjective. So I understand that you're not going to, have a click with every person, but it's important to have a very good patient-provider relationship. It's like first and foremost, especially with your face, you have to make sure you trust the person you're with. You have to make sure as an injector that your patients are compliant. They understand what you're doing. They realize why you're saying what you're saying. It's all of it's very important. So Masseter, we did the whole upper face so far. I don't think I left any out. What else? Let's see. Let's move down. So right here, you'll see the corner of this muscle right here that's kind of going down from my mouth, the corners of my mouth, and there's another one here. These are called DAOs. It's obviously an acronym, but it's responsible for pulling down the corners of the mouth. So I have patients who have marionette lines, and they come and they say, can Botox fix this? Botox, again, is for movements, right? It's for movements. If you can make a sad face, mine is like dead. I've been doing mine forever, but some people can turn their mouth upside down. I can't. Y'all get the point. This muscle, when you inject Botox into it, prevents that. So it shouldn't look super weird, but like, I can't really pull my mouth down. It's not going to help with like marionettes that need filler. Sometimes you need filler for that. It's going to prevent them from fully creasing and forming and being so strong because the lines are from years and years of us making those movements. Some people genetically just pull down at the corners of their mouth. You laugh, you talk, you speak, and you do that. It's perfect for those types of people, but it's not going to fix the lines at rest. You need filler for that. This is just going to help with motion because it's a paralyzing agent. And that's the DAOs. And you'll kind of go down and you'll notice the mentalis muscle. That's the chin muscle. It's responsible for, these are really far apart. They're closer together normally, but the dimpling, we call it Chinelitis. Okay. I call it that. Probably no one else. I'm a nerd. The dimpling, putting Botox here stops the dimpling. Some people, when they talk, you could see their chin dimples up. And what happens in the long run is you develop this like crease right here, this mental crease. Some people have it without that. It could be genetic, but you pulling up at your chin constantly for your whole life is going to cause a little crease. So treating this will thin this muscle out so it doesn't look so bulky. It'll pull it down a little bit so it's not dimpling up all the time, and it smooths out that Chinelitis. Something to remember when you're doing that, something that I've learned by having it done myself, and something I've heard from patients. Number one, it looks really weird when it's kicking in. So the first few days following this treatment, it looks weird. It looks like it bunches up almost, but that is temporary. Something else you'll learn from this muscle is when it's wearing off, if you're very, very strong here, it might spasm. It just means that you need more units, that's all. So it might spasm because some of it's working and some of it's not, kind of thing. So that's the mentalis muscle. We talked about all the ones around here, I believe. I don't think I left any out, at least not any typical ones. Not seeing anything. So let's talk about complications down here. If you hit, if you're trying to hit these DAOs to stop this, and your injector doesn't know their anatomy, and they kind of like go too far this way, and they hit this muscle right here, oh my God, it looks like this. Let me see if I can, my mouth is so dead. It's like this. It pulls down. It looks like you can't, that's the muscle responsible for lifting up your smile, for keeping it up. If you hit this, this is gonna kind of go down like this for 3 months, and there's nothing you can do. Groupon Botox. Someone wrote, have you heard about mewing movement to build the masseter? I don't know what that is. Nope. Mewing. Nope. Don't know what that is. Someone just asked, what is Botox and what is it used for? So I would encourage you, The first half of this, I kind of explained what Botox was and what it does and stuff. So I would encourage you, when I repost this to my actual page, to rewatch it, because that's at the beginning of the video and it's super intensive. So for the sake of time, I'm going to move on, but that will be at the beginning of this video. So Botox for the neck. So yeah, I was moving on to the neck. That's a good point. So there's a few uses for Botox in the neck. The first use, and you'll see mine because they're embarrassing and I have to do them so bad, is this. See those? These are platysmal bands. I know that people are not walking around going like this all the time, but sometimes when you smile, you could see them, right? So in pictures, people will see them and it bothers them or it ages you. Sometimes a lot of my bodybuilders, when they're working out and they're straining, you can see them, it bothers people. So Botox can be placed right over the bands like this, and it will relax those. So when you make those motions, this is all very smooth. A side effect of that is softening these horizontal fine lines in the neck. It actually pulls them apart, which is really nice. Now you'll see some people post that like the whole neck has little dots over it, like they did the entire neck. It's more of a skin conditioning treatment when they call it like the Nefertiti neck lift. That's more of a skin conditioning. It's pulling these lines apart right where they are, acutely pulling them apart. So you can also march the Botox over the neck in this kind of like distribution over the lines, and it will soften those lines up a lot. It does take a lot of units, usually 30 to 50 units on average in the neck to do that whole thing, but I find it to be worth it. Mine used to be super deep, and yes, they're still there, but they're much softer. But remember that doing treatments like microneedling, taking care of your skin and things like that will also help to soften these tech neck lines up, which bother all of us so much. As people age, you'll start to notice it looks like two bands right here. And my mom, she was like telling me I need a neck lift. I see these two bands and it looks like sagging skin, almost like this. A lot of the time, that's actually your platysmal bands, and the lack of tissue around the neck as we age makes them look like sagging skin, but they're like two very distinct bands right here and right here. You could see it when I go like that. See? So treating those with Botox sometimes will reduce that illusion where it looks like you have like two sagging skin, right? I mean, you might have sagging skin. That's something that needs to be assessed, but it can help that. Other uses of Botox that we haven't talked about on the face or the neck. Hyperhidrosis. I do this all the time on people. So the armpits and the hands and sometimes the feet. Some people have a condition called hyperhidrosis. This is a therapeutic treatment. It's to reduce the excessive sweating that comes with that. So some people just have overproducing sweat glands, okay? Swimmers do this all the time too. And you can inject Botox into those areas and kind of reduce the sweating, especially in the summer. It's very helpful. Now, it takes a lot of units. It takes about 100 units, 50 per side, 50 per side. It's about 100 units. I don't know what the status is with insurance. I don't know if other offices like internal medicine or family medicine or someone can do it where it's covered. I have no idea, maybe derms. But I mean, I do it for people all the time. It's just a lot of units. You could use your brilliant distinctions points towards those treatments, but it's really therapeutic. It's very helpful. Another thing I'm kind of going to glaze over, I'm not going to go too deep into it, is migraines. People ask me about Botox for headaches all the time. I am not a general care physician. I'm not a general care PA. I'm not a general care nurse. I do cosmetics purely. There are some things I do that can reduce the headaches, like treating this angry line here. Doing this a lot causes a tension headache. That's a headache just from like straining and doing this a lot. It helps those, like it helps to reduce those because you're not doing this all the time. And masseter, sometimes we get a headache from clenching our jaws, and treating the masseter can help those headaches. But a proper migraine with aura, like if you're diagnosed with migraines, the treatment with Botox, first of all, is a ton of units, and it's sprinkled around the head, the occipital portion of the head, and around here. So I always tell patients, if you can get that covered by a neurologist, I know they cover them, most of them do. I would do it with a neurologist and get it covered because, again, I'm not trying to suck everyone dry of their funds. I'm trying to help you guys. So if there's a way that you can do that without spending a ton of money, I'm going to try to get you to do that. So all in all, that's all the muscles of the face I kind of went over. I went over some complications. I went over, what the muscles do, their insertion points, kind of the results you would see from them, and all the rare areas. I know someone said in one of my polls I posted they want to see like rare areas of Botox. that explains the rare areas. So if you have any additional questions that you didn't ask me during the video, I'm having a really hard time right now answering DMs. I'm like very swamped. It's getting overwhelming. I don't know what's going on right now. I don't know if Mercury's in Gatorade. I don't know what's going on with the planets. I don't know what's going on, but DMs are getting pretty buried right now. So if you have a question about this video, do me a favor and comment it on the video after I post it so I can actually like organize it better and answer all the questions. So hopefully you guys enjoyed this. I'm sorry about my annoying voice and that you had to sit through it for like 20 minutes. I'm going to do another one of these with the vessels whenever I get a minute, and I'm going to do another live kind of geared towards injectors when I get another minute after that. But I appreciate you guys watching and caring about what I have to say and like caring about education, because I was never educated before I was a physician assistant and I was a patient. They never told me what to look for or what to expect. And now that I know all these things, I wish I had been educated. So I like to do that a lot on my Instagram when I can. Hello and goodbye, everyone, and thank you for watching. I appreciate it.